So, Jamie, I'm really excited to present to you all about our pedestrian safety programs and campaigns that we have been working on for several years now. So the first one I'm going to present on is every fall, according to the data that we gather, most of our pedestrian crashes and fatalities happen between September and November, a little bit into December as well. So we always have a pedestrian safety campaign every fall, and we actually just started it last week. And we're doing a similar campaign to what we did last year. This year's is Pedestrian Myths or Driver Myths. So it's teaching people the difference between the myths that you hear about how pedestrians should be acting on the roadways and myths that drivers should know when surrounding pedestrians. So I'll show a little bit of those in just a second. Okay. So yes, I'll talk a little bit about this. A pedestrian safety campaign that we're running right now, Know the Pedestrian Myths. So here are just a few videos that we show online, and it's kind of just, they're fun. They talk about pedestrian safety and what the myths are and actually what the facts are after that. I'll show you that. Okay, so if you didn't read that, it just says, you know, what a myth is that it's okay to look at your phone when you're stopped at a stoplight or a stop sign. Really, the fact is, it's never safe to be distracted behind the wheel. So we want to make sure that people understand that those myths, because we found that a lot of pedestrians are hurt because people are distracted behind the wheel. So we want to, you know, get those messages out that it doesn't matter if you're stopped at a stoplight. You shouldn't look at your phone. You should never be distracted behind the wheel. Here's another video. These are all on social media. Okay, and then that one's kind of fun. That one just says that crosswalks only exist when they're marked at certain intersections, when actually there are unmarked and marked crosswalks. So every intersection there could be a marked and an unmarked crosswalk. So every intersection is a crosswalk basically. And that pedestrians have the right of way at every intersection. They don't have the right of way in between those intersections if there isn't a marked crosswalk. So that would be considered jaywalking. So we want to let people know that if there is an actual intersection, and also let drivers know too, that if they see an intersection, whether there's a marked crosswalk or no marked crosswalk, the pedestrian has the right of way. Okay, let me see, I think I skipped one. Here's one of our other fun ones that we're running right now. You know, and from our data, we found, you know, people think, well, pedestrians won't be out at night, you know, that's not a major concern. When really a lot of most pedestrians are out between 6 and midnight. You know, as the time changes, as it gets darker in the evenings and it's nice and cool, people are out running or walking or just going about what they do. And we need to let them know that there are going to be people out, especially in the evening. Okay, and our campaign runs through Halloween and through Christmas. So these are just some fun ads that we ran actually last Halloween around that time. And just reminding people to, you know, stop, you know, pause a little bit before you make that right turn to make sure you don't see any pedestrians. It's another Halloween one. Reminding everyone to yield even at a green light. Make sure pedestrians are out of the way. And here is another holiday. This is a holiday one we did last Christmas. We'll probably run similar ones this Christmas and Halloween as well.
Ho, ho, ho.
Again, this is the crosswalk message, similar to the one that I showed you earlier. Stressing that to people. This is our last holiday. Reminding people that, especially at that time of year around December, when it's dark at what, 4:30, 5 o'clock, to always be watching out for pedestrians. It's harder for pedestrians to be seen in the dark. And we're actually coming out with new messaging to reminding people to, if you're going to be out when it's dark and walking around, make sure you have something reflective on, whether it's like a reflective bracelet or, you know, a jacket with some reflective features on it, or a light, something that lights up, because even bright colors can't be seen as well as reflective or something that's lit. So you can go to the website. You can see here Pedestrian Myths .utah.gov. You can read all about those, what the myths are. And last year we had a press event where we were at Gardner Village, just reminding people to be safe during Halloween. We do see a lot of pedestrian crashes and sometimes fatalities around the Halloween season. So we're really stressing that. And we'll again have a press event around that time as well in October. That was that. And then every fall we partner up with the driver license division, and they we style a t-shirt that they can wear. This year it's going to just be a Zero Fatalities t-shirt, and we put special messages on their boards while people wait to renew their driver license. So we love that partnership with them, and they like to work with us on getting some safety messages out to the public. So that was that. And the next campaign I want to talk about, or program actually, I want to talk about is Safe Routes Utah. And this is the website, saferoutesutah.gov. And there are a couple of different features to this program. We want to, create, our goal is to create a safe route plan that shows the safest walking and biking route for kids to and from school, and get those kids those maps. So as part of Utah State Code, it states that every elementary and junior high or middle school in Utah must have a safe route plan for their school, for their students to walk to and from school. So that's the school's responsibility, and they're responsible to give that to UDOT. And we created a software for these schools to make it really easy for them to create these maps. So they go in and they create these maps, and then they're responsible to getting those to the students, to let the students and parents know this is the safest route for your child to walk to and from school, to our school. And so we've done that, and the schools can go online, and we have tutorials on how to make those maps. And then you can also go to the saferoutes.utah.gov website. Parents can go there to find that map of their school. We have a lot of them. Some school districts have chosen to just create their own maps, which is fine. The law just states that they need to have some route created and given to the students, or posted on their school websites for them to see. So that's just a really cool feature, and we really want to encourage people to our kids to walk to and from school, whether that's their parents walking with them or whether they're just in a group walking to school and then walking home. Mainly because it's really good for a child's health. They're able to focus better in school. They've got a little exercise before school. They get out and hopefully the air is sometimes clean and the fresh air, even in the winter, they can bundle up and walk to and from school. And we really encourage that. And then we also have an assembly, which I'm going to show bits of those in just a minute. We've created an assembly, and we go to first through third grade classes, and we have a certain assembly that we give to first through third graders. And we have presenters who go and give these presentations. They're really fun and interactive, and I'll show those in a minute. And then we have another fourth through sixth grade assembly as well, which is more for the older kids, and just really talking about how do they get to and from school safely. And then we also have a walk and roll challenge. Parents just need to go on to the saferoutes.utah.gov website. They enter in the number of days that their kids have walked to and from school, and they're automatically entered in to win, possibly winning prizes like a new scooter or a new bike or a new helmet. And we every month we choose someone and all over the state of Utah to win these prizes. So if you know anyone who wants their kids to walk to and from school, and just go onto this website and mark how many days every month that they've walked, and they can win some pretty cool prizes. And then these are the assemblies. You can see the first one on the right, on the left is more centered to like video games for 1st through 3rd graders. They're really cute and really fun. And then 4th through 6th grade is more kind of has like a style of like Fortnite. I know that a lot of 4th through 6th graders love that. So we kind of turned it into something fun like that and more I guess cool for 4th through 6th graders. So I'm going to show a little bit of these. I'm not going to show the whole videos. They're you know what, 15, 20 minutes long. So I'm not going to show the entire thing, but I'll just show a little bit.
Hi everyone, my name is Chris, and today we're going to learn how to beat the street. We'll learn how to be safe and smart near streets using the word CAR, which stands for Cross, Alert, and Ready. We're going to beat the street by working our way through 3 levels, just like a video game, leveling up with our safety knowledge as we go. Are you ready? Okay, let's get started. This is your street, or my street, or maybe your teacher's street. It may look perfectly safe right now, but to be ready to cross this street or any other street, we need to know that danger is always just around the corner. Yikes! You see? Streets can be a little scary, but we can beat them. It's time for level 1. The first letter in the word car stands for cross. So, how do you cross safely? Well, let me introduce you to a few of my friends that can help us out. Their street crossing knowledge is out of this world. Meet Crossing Kendrick, Irene, and Listening Lyra. They are going to teach us how to cross safely by learning how to properly stop, look, and listen for cars. Kendrick is about to cross the street. Is he going to stop first? Where is he going to stop? Right before the curb. Giving plenty of space between you and the street is perfect. Nice work, Kendrick. Now, Irene is going to show us how to look before we cross. She looks left, then right, then left again, checking for cars. When she sees it's safe to cross, she continues to look left and right while she's crossing. It's important to keep looking out for dangers even while you're walking. Way to go, Irene! Okay, let's pause for a second. It's easy to look left, right, then left when the street is empty. But what if there's something blocking your view? Oh! Wow, that scares me every time. This car is in my way. I can't see to my left. There's nobody in the driver's seat. So what I need to do is walk to the edge of the car and peek around so I can see if it's safe to cross. I look left, then right, then left again, just like Irene showed us. But what about large truck? Whew. No matter what may be blocking your sight, always cautiously look both ways at the edge of the vehicle. It doesn't matter if it's a car, a large truck, or a... Uh-oh. An elephant waiting for the bus? Hi, everyone. My name is...
Okay, so you can see those are really fun. And when we do, so actually these videos were actually created during the pandemic or during last school year when we couldn't go into the schools, when assemblies were not being held. And I don't know if some districts are allowing assemblies anymore or not, but either way, we created these to be shown online. so that teachers can actually show them in their classroom, so that we don't have to go individually to each classroom, or because we're not allowed to go inside the school, that they can show these. And this is kind of the presenter there instead of us presenting. Because usually when we go to an assembly, back in 2019, we would go to an assembly and we didn't have this person. We would actually have a real presenter presenting all this on a screen. So they're a little bit different now. But we are working on getting, actually schools right now are signing up to actually have a real assembly and have a person come present. So yeah. And then next one. So this is our 4th through 6th grade. I don't think we've ever done a live presentation on the 4th through 6th grade assembly yet, because this was actually just created back in 2020. And so this one is available to parents and online. You can watch it online, or teachers can show it in their classrooms. So I'll show a little bit of it.
What up, safety crew, and welcome back to the channel. Thanks for tuning in. Today, we're playing a game I've been looking forward to for a long time. It's called Beat the Street. The objective is to get where we're going safely, but it's not as easy as it sounds. We've got to avoid cars and trucks out on the road along the way. So it's us versus giant metal machines. Get it? Got it? Good. Okay, let's do this. So we start off with our daily challenges. We've got to earn our badges to become a safe routes hero. Let's dive into it. We have to be aware of crossing dangers when we're trying to get where we're going. We can't complete the objective if we don't arrive alive. Check it out. Pedestrian crashes are one of the leading causes of injury-related deaths. That's real life. It's no game. So we gotta take it seriously. So, how much distance does a car need to stop? Got any guesses? Let's spawn in and find out. If a car is driving along at 20 miles per hour, like in your neighborhood, it needs 3 car lengths to come to complete stop. Too bad there's no real-life double jump.
Now, let's pick up the pace. If that same car is driving at 40 miles per hour, think a busy street by the grocery store. It needs 6 car lengths to come to a stop. There's definitely no dodging that. And finally, if that car's driving at 60 miles per hour, like on a highway or freeway, it needs 12 car lengths to stop. I don't even have that many fingers. If we're in its way, and we're any closer than that, it could be game over. All right, we got a badge. Now we know some of the crossing dangers, so we gotta remember them when we're out there in the real world. Let's cut to a clip showing what emergency responders in our state have to say about it.
My name is Eric Anderson.
Okay, I'm just going to stop right there. You can see that this one, this video is actually a little bit more serious, and well, it's fun, but it also, it talks about more, this video is actually a lot more serious. It talks about pedestrians, what really could happen if you're not safe, if you're not watching out and not being careful. And I feel like we felt like with 4th through 6th graders, we could do that. We also added in like some math problems here, it's 60 miles an hour. How many cars does it take for that car to, how many car lengths does that take for that car to stop? So we felt like we could, get more into detail with these kids about what they need to do. So there's that one.
What up?
And then at the end of each of these presentations or assemblies, we have a quiz that they can take online. And they're just so we make sure that they understand what's happening. We feel like the best way to judge if we're actually teaching them something is to actually quiz them and to see what they've learned from it. And so those are available online as well. And then another thing that we've created is this Living Planet series. So we work a lot with the cities on providing information to crossing guards. And every, our crossing guard videos were getting a little old, so we decided to create some new crossing guard videos for them. And it's really fun. This kind of goes off the Living Planet series. I don't know if any of you have seen that. I don't know what network it's on, but they're just, very educational about, watching for animals and stuff like that. So this is kind of a take on that, but it has to do with crossing guards. And I think this is episode 1. There's a bunch of episodes. I'm not going to show all of them because that would take a lot longer time. So I'm just going to show this first video.
Since the dawn of time, humans have populated the Earth with tiny replicas of themselves. Children. Children who bounce about their daily activities are remarkably smaller than fully grown adults and are therefore harder to be seen from moving vehicles. Children are prone to mix fantasy with reality. Their lack of ability to sense speed and distance, combined with 1/3 less vision than adult humans, and an inclination to listen to only things they like, make them unsuspecting prey for swift cars and commuting drivers. Children are often found at schools, where they learn right from wrong. But on their way to schools, they often pass through intersections. And every intersection has one thing in common: crosswalks. There are 2 types of crosswalks found in the wild: marked crosswalks with painted lines, and unmarked crosswalks without any painted lines. Now, pedestrians of all types, including children, have what's called the right of way at crosswalks. This means when a pedestrian enters a crosswalk, vehicles must stop and stay stopped until the pedestrian has finished crossing. In all other sections of roadway, cars have the right of way. The following series is an intimate examination of intersections and those who cross them.
Okay, so that was the introductory video to those. And then this video, this next one I'm going to show is, we also made some social media videos to go with it. And these include tips that crossing guards wish people knew for both parents and children. And here's just one example of that.
Let's take a closer look at crosswalk safety. Drivers are free to drive through regular crosswalks once a pedestrian is no longer on their side of the road. But at school crosswalks, drivers must wait until all creatures, large and small, have entirely crossed.
Okay, so that is one of our social media videos. And yeah, that is all I have for this presentation. So yeah, we're right in the middle of our pedestrian safety campaign right now. And if you know of any schools who would like to have an assembly or would like to know more about this, about the Safe Routes Utah program, let me know. Otherwise, that is all I have.
Awesome. Thank you, Kristen. Does anybody have any questions for Kristen? Anything about the campaigns that are going on or zero fatalities? Please feel free to come off mute or put it in the chat. Everybody's quiet today. All right, if you guys think of anything, go ahead and ask later, throw it in the chat, but then Megan, we will turn it over to you.
Okay, can you hear me okay?
Yes.
Okay, perfect. And then did you give me sharing capabilities?
Yes, I did.
Perfect. I don't want that. Okay. Okay, perfect. So Thank you, Kristen. So Kristen was talking all about the prevention of we having any sort of injury. So I'm going to move on to more of our, after it's happened, we're going to talk about some things that we can do on scene to kind of move to more of our mitigation phase. So these are learning objectives. So I want to discuss the initial accident response. What I want you guys to prioritize if you are a bystander on scene. We're going to review the trauma assessment. So anybody who's taken TNCC or ATCN or anything, or EMS, if you've reviewed any of that recently, it's going to be some good review or some familiar for you. If you haven't done your trauma assessment for a while, it's going to be some good review. We're going to discuss the importance of MOI, or a mechanism of injuries, when we talk about auto versus ped accidents. We're going to highlight the different injury categories that you're going to see for each group of patients. And then some treatment expectations. We're not going to touch too much on this because I'm not a trauma surgeon and we don't have any trauma surgeons in our group, but we'll talk a little bit about what to expect. And I'll kind of highlight the differences of what we'll see between each of our ERs. And I know we have at least 1 or 2 ICU nurses. So if you guys want to give input as an ICU staff, that will be also awesome, because I'm mostly going to focus on that initial response and our ED peeps. Also, what I haven't added to our learning objectives is I just wanted to touch real quick, and Jamie, you can tell me if you don't think that's appropriate, but I thought maybe Good Samaritan laws would be okay to touch on just for our state, just because when I was initially researching and I was looking up autoped accident categories, injuries, everything that to expect on my Google page, the first 8 out of 10 websites that popped up were lawyer sites. So this is really big legally wise. So let's get started. Our initial accident. So let's say you either come upon a scene of an accident, or so there's a car stopped and a person is lying on the road. Also, heads up, if I know you, I'm totally going to pick on you. And I know at least a handful of you guys in the audience right now. So you see somebody lying on the road. Miss Sophia, are you able, because I know you're at work right now. What do? You see someone lying in the road. What do you want to do? She able? No. What about Andrew? Andrew, are you available? What about Becca? Becca Edmonds, are you available?
Yeah.
Perfect.
Kids in the background, but I'm here.
That's okay. Fantastic. We got a winner. Okay. So let's say you come upon an accident. You see a car stopped. You see someone lying in the road. What do you want to do?
Look at the scene. Make sure you're safe to continue.
Oh, fantastic. Thank you. Yes. That one thing that in our natures, as healthcare providers, is it's kind of in our nature to respond to that person first. We see somebody hurt, we want to fix it. We run towards the danger, not away from it. But we have to remember that we need to make sure our scene is safe. If our scene is not safe and we immediately run into that scene, we can, let's say that there's a down power line that we don't see. We can not only not render aid to that victim, but now there's 2 people that need to be rescued instead of 1. It can limit resources, it can delay transport time, it can exponentially complicate the situation. So the first thing you need to do is make sure your scene is safe. Do not rush into any scene without assessing. Make sure EMS has been called. If police are there, get them involved, get traffic controlled, get things cordoned. If you have road flares, things like that, make sure that you just aren't rushing on and causing another victim in the area. So use your judgment. Don't let your bad or good intentions make a bad situation worse. Another question I have for you guys is if you're going to move the patient. Amy, are you able to interact?
Yes.
Fantastic. So let me ask you this question. So if you have a patient who's injured, are you going to move them?
Kind of depends. If the
Okay.
patient's, if like the car is on fire and you need to get and there's somebody still in there, and you can kind of ignore sort of C-spine, get them out as safely as you can, but get them out of the imminent life threat. If it is a safe scene, then no.
Yeah, perfect. Absolutely 100%. If you have, like Amy was saying, if you have immediate danger on scene, a car's on fire, There's a gas leak. There's something like in I've taken wilderness medicine courses as well, and they say the same thing. Like if you have an oncoming rampaging rabid bear, you're probably going to want to move the patient a little bit. But yeah, same thing. If the patient is safe, if the scene is cordoned, there isn't any immediate like explosion, hazmat hazards, anything like that, don't let them move the patient. So if you have like other bystanders who have good intentions or like, oh, this cement is so hard, let's move them to this grass over here, it's a lot more comfortable, make sure you tell them not to move the patient unless there is some sort of, you know, life-threatening thing on scene. Okay, so you have your patient, you have made sure your scene is safe, you make sure the patient is secure, they don't have any immediate life-threatening things in the scenario. So you move on to your assessment. So your scene is safe, now what? So there's a few different trauma assessment tools that you can use. There's, we go through this in TNCC, you go through this in ATCN. This is, this particular chart is actually taken from the NRAMT site, but it all kind of gives the same gist. So it's giving you that systematic approach of what you are going to assess first, especially in a trauma situation. In situations where you have high amounts of adrenaline, it is going to shut off that thinking to, oh, Andrew, I just saw your message. Sorry, my mic isn't working. That's okay. All right. So in times of stress, when you have those bursts of adrenaline, it can cut off that blood flow to the frontal cortex, which means you're going to have a hard time thinking, you're going to have a hard time remembering because you've discussed so much adrenaline. So this gives you that systematic approach. So you see that you start out with your scene safety, how many numbers, has EMS been called? And then you're going to move on to initial assessment. So when you move on to your initial assessment, is there something, come on. Okay, there we go. So get your scene impression. What does this person look like? What shape are they in? Are they moving on the ground? Are they not moving? What position are their limbs on? How far away are they from the car? Getting your initial impression of the patient. Also, is there something that you should prioritize? So let's say I'm going to pick on Haley McKinney. Haley, are you able to talk?
Yes, can you hear me?
Yes, I can. Okay, so Haley, can I ask you, we have our basic BLS assessment, so we have our ABCs, but is there something that we prioritize if we're in a trauma situation?
Yes. Well, you want to make sure they're not bleeding.
Yeah,
like hemorrhaging.
Absolutely. So why do we want to make sure that they're, don't you want to make sure they're like breathing first? Why are we prioritizing our hemorrhaging?
If they're hemorrhaging, they'll just bleed out immediately, and it doesn't matter if they're breathing or not. Their blood pressures and everything will drop.
Yeah, absolutely. So our number one preventable death in traumas is uncontrolled hemorrhage. And so if you come on scene and you see a patient who is just massively hemorrhaging anywhere and someone's trying to give them like rescue breaths, you're gonna want to prioritize that hemorrhaging first. Apply your tourniquet, put pressure, want to make sure you control that bleeding. Well, my cousin, for example, he witnessed a car accident and a guy ended up losing one of his legs. It got pinned in between like the dashboard and his seat, and his leg came off. So he ended up using his belt as a tourniquet. So yes, you want to prioritize that uncontrolled hemorrhage. There's this great video that I could not find. I actually limited the amount of graphic pictures that I was going to put in this presentation because A, I figured we didn't need any more ammo for our nightmare banks, and B, because I couldn't find the horrific pictures that I wanted to. But one of them is a really great one of this person who, this was down in like Brazil somewhere, because you can hear him speaking Portuguese in the background, and there's a guy who's in a motorcycle accident, and this camera pans to the asphalt, and you just see this huge puddle, and then you go to the patient, you see that one of their legs has been ripped entirely off. Well, EMS is all at this patient's head. They've got like a face mask on, they're giving this patient oxygen, and they've totally neglected the fact that this patient is hemorrhaging. So remember, yes, you always want to prioritize that C. Once you see your initial impression, and obviously in your trauma assessment, you're going to continue to reassess for hemorrhaging, but after you initially do that, then you move on to your ABCs. So do your BLS. Is your patient moving? Are they speaking? Can they tell you your name? Also, Remember, if your patient is conscious, what do you want to get first? Is there something that you want to get from your patient? Shelby, are you around? No. What about Leslie? Leslie, I'm going to pick on you because I know you and I like you.
I am here right now, but I missed the question because I have to go take a phone call really quick.
No, I just wondered if your patient is conscious, do you want to get something from your patient like before you start touching and messing?
Like other than just making sure that they can respond to your questions.
Which is good because you're assessing the level of consciousness, but is there anything else you want to ask them while they're down there?
Are they having any pain? I don't know what you're trying to get at. Sorry.
No, you're good.
totally
It
missed
just
what the
means I'm
part
not
is.
asking the right question. Legality wise, is there something I want to know about this patient?
Oh, if they're full code or not?
I mean, yeah. You can say, sir, before I waste my time on you, I need to know if you're a DNR. What about if they consent to your treatment? If they are conscious, you introduce yourself, see what's going on, see if they can tell your name and say like, is it all right if I go ahead and do an assessment? Yeah, Rebecca, yeah, got it. Can I help you? So that consent is important. If they are unconscious, then we are going to operate under the assumed consent. Sorry, Leslie, you can go take your phone call. Thank you for participating.
It's cool.
Okay, so yeah, not only that, but when you're getting their name, if you're getting that consent to treat, what can you determine about this patient? And I'll leave this open to anybody who wants to throw it in the chat too, because I know some mics aren't working. Like I have the chat up. So what can you determine? You've just asked this patient, they told you their name, they said that you're okay to do an assessment. What have you determined about this patient? Yeah, level of consciousness, a clear airway, absolutely. If a patient, so you can hear them speaking, you don't hear them wheezing, it sounds like it's coming out of clear airway, we can establish that our airway, for the most part, is clear for right now. And they are neurologically intact. If they can hear you, if they can process what you've just said to them, and they can respond coherently, we know that we have most of our nerves intact there. So we're feeling pretty good. Patient sounds like they're at least a 14, probably a 15, which is good. Good to establish that baseline. So looking at our airway, we've asked them their name. Let's say that they can't tell us their name. And I've still got the chat up, so you can throw in stuff in the chat. So let's say that they can't tell you their name, they're unconscious. How are you going to assess that airway? What's really important in this patient? Maintaining stability of what? C-spine, perfect. So this patient has just had a major traumatic event, and we're going to talk about a little bit of mechanisms and the areas that get hit in just a second. But yeah, so maintaining C-spine, so you're going to want to do that jaw thrust maneuver. You're going to want to look for teeth, blood, vomited secretions, facial deformities, all those things. Do that jaw thrust maneuver, check your airway. Move on to your breathing. Are they breathing? Is it equal? Is it bilateral? What's the rate, depth, and respirations look like? So moving on to your breathing assessment. And then you can go ahead to your reassess your C's again. So we look for uncontrolled hemorrhage, but you're still going to go and assess your circulation. What does their skin look like? Check your pulses. If I can feel a central pulse, but I can't feel a peripheral pulse, what is my systolic sitting at? What is my systolic probably at? If I can't feel a peripheral pulse, but I can feel a central pulse, any ideas? Jessica says less than 60. Yeah. So if I can feel a central pulse, then I'm sitting about 60. It means that I'm getting maybe some of my central organs perfused, but it's not getting my periphery. If I can feel a peripheral pulse, I've got at least an 80 systolic, and it means that all my organs are perfusing for the minute. So I'm okay right at that second. If I can't feel a pulse at all, we're going to go straight to our BLS CPR protocols. Okay. So during this time, checking to see if you can get, after you do your ABCs, move on to your neurological assessment. Can you get this? Does this patient rouse at all? If you sir, can you hear me? Lightly tap. You can do your central, what's it called? Check for like your trapezius pinch and your orbital stimulation. So central stimulation, peripheral stimulation, check to see if they respond to pain at all. See if you can get that established GCS. Why is it important to get your baseline GCS in this patient? I still have the chat up if you want to throw in a suggestion.
If you have that initial GCS, then you'll be able to tell if it starts to change or drop.
Yeah, and why is it especially important in an auto versus ped accident, auto versus pedestrian? What do we run high risks of? Yeah, changes happen fast. Want to assess later for that GCS. Yes, internal bleeding, yeah, in our brain. So our brain bleeds. So I'll show you the chart in just a second, but in our auto versus pedestrian, they run a pretty high risk of that head injury. So getting that baseline is very important, because let's say initially EMS responds on scene and our patient is up and talking. They call report, and in the middle of calling report to the department, they're like, oh, patient is now unresponsive, GCS of 8. We know that we are dealing with not only a brain bleed, but a fast brain bleed. So this is pretty serious, and you very greatly upped the ante. Okay, moving on here. So we talked about assessing your ABCs. What intervention can we do beyond ABCs that affect a trauma patient? Anybody have an idea? I'm not talking like a needle decompression. I'm not talking like you're going to do an emergency tracheostomy with a pen and your handy pen knife that you're going to stick a straw in there and save this patient's airway. Yeah, Wendy, why do I want to keep a patient warm? Why do I want to keep this trauma patient warm? Yeah, because of our triad of death. So our triad of death, remember, we have the coagulopathies, acidosis, and hypothermia. If we have a patient who's just experienced traumatic event, and especially as we're getting into fall and winter, ability to thermoregulate goes kaput. Also, yes, absolutely. So triad of death and their ability to thermoregulate. Remember, we want to keep our trauma patients warm, which is why we keep our trauma bay temperatures up, which is why as soon as we expose them and get them trauma naked, we immediately want to cover them with warm blankets. We can increase their risks of mortality by causing this, like combined with acidosis, can cause this like a cascade of coagulopathies and cause DIC in a patient, and they clot and then subsequently bleed out. So if you can, keep your patient warm. So maintain your C-spine precautions, keep your patient warm, continue to do your assessment. Head, neck check, chest, what can you see? What can you give to EMS as soon as they respond on scene? What can you tell them that they can immediately prioritize as soon as they get in? You're probably not going to get too much into past medical history unless you have somebody there who witnessed it and can tell you. Maybe they have a medical bracelet, things like that. But really it's going to be like, what can you see? What can you assess? What's going on with this patient? What's their GCS? Beyond this, let me see if what else is very important? What else is very important in this history right here that we want to ask any other bystander or someone who was there when it happened? What do we want to know in our sample? What's going to really affect this patient? How'd they get hit? Not only how'd they get hit, but yeah, speed. Why do we want to know speed? Why is speed important in an auto versus pedestrian accident? Changes the injuries that we will assess. So do you guys remember your kinetic energy formula? It's like KE equals MV times 2. So if we have a big truck, we're going to be worried because there's a lot more mass. But what if we have a car that was going 15 miles an hour as opposed to a car that was going 40 miles per hour? Yeah, Wendy, excellent. Higher rate of miles per hour increases your greater risk of injuries. So this next slide right here, more ouchies. That is, I believe, the technical term for that. Okay, this is straight from the auto versus pedestrian website that we just talked all about with Kristen. So you guys see here that at 20 miles per hour, 9 out of 10 survive. At 30 miles per hour, that goes to half. And at 40 miles per hour, 1 out of 10 pedestrians survive a crash. So remember when we were talking about factors that affect your kinetic injury, which basically translates to how bad your tissue is going to get damaged. When your velocity is doubled, you quadruple the energy. When if mass is doubled, you only double the energy. So your speed is going to have a huge factor. So make sure to educate this patient and any family nearby. So especially if there's refusal to transport. So let's say that you have somebody who's hit by a car. Let's say they don't have insurance. Let's say they're an illegal immigrant and they're worried about deportation. Let's say there's a language barrier or something, and you know that this speed that occurred. Let's say that this accident occurred at greater than 30 miles per hour. It is very important that you take the minute to educate that person and say, look, I really think, obviously you can't force them. If somebody tries to walk away from a crash, you're not going to run and go tackle them and say, no, you must go to the hospital. No, but it's really important that you educate them and be like, look, you could have injuries that you don't know about, especially if somebody is hit and you witness it and they lose consciousness and then they gain consciousness back. What is this? What can this be a sign of? Does anybody remember their head injuries? If someone initially loses consciousness, yeah, so they've got your epidural bleed, and those bleeds typically involve arteries, which is a bad day for this person. So it's really important to educate these people and say, no, I don't want to be transported. And you're like, look, I totally understand. I respect your decision, but just so you know that you could have some really severe injuries that you don't know about until this adrenaline wears off and you start to feel more pain, or maybe, I know you lost consciousness. So I think it's a really, really, really good idea, really important that you go and get scanned and make sure that you're still okay. So that's where you could come into that too, is really educating the populace about just how much more serious their injuries can be, even if they don't initially present as such. Hold on. Yep. So very important to educate them. Also, just so you guys know, once we get above 40, it's a very specific speed, 49.7 miles per hour, the chances of survival virtually become like 0%. So speed is very important. Let's see, click through here. So let's talk about our injuries. Let's talk about what we expect in an auto versus pedestrian accident. So this is for adults. Do you guys see here? We've got our point of impacts where it's going to start here at your knees, your shins, your ankles. You're going to get those displaced fractures. You can get it on your femur, depending upon where, if it's like a smaller coupe versus like a bigger sedan, like how big the grill is, what kind of car. But I want you guys to notice something else here. Do you guys see this little ellipsis here with this head trajectories? So even if this car is only going 20 kilometers per hour or, like 40 miles per hour, do you see how much faster your head, due to the slingshot effect, where it's going to hit your knees and it's going to whip your head down to the windshield or the top of the car? Do you see how much faster it's hitting that? So we've always got to be very worried and very, very aware that our head is going to be our priority. Our head and our C-spine stabilization. So making sure that you're keeping that patient secure, making sure that you're keeping that patient from being jostled around because their head initially could have hit the car going so much faster. But these are common injuries. Like I said, once again, these are for adults. So our lower extremities are going to make up the majority of our injuries. You're going to see a lot of those ugly lower leg fractures. But then our second highest category is our head, face, and neck. From there, it just kind of counts down. So on scene, what we can do just as initial first responders, bystanders, is if we have, let's say we have an open fracture and uncontrolled hemorrhage, we can apply those tourniquets. If we have a complete loss of limb, obviously tourniquet, and then head, face, and neck, maintaining that, getting that initial baseline GCS so they can track this patient's progress, making sure that they stay stable and we don't exacerbate any further injuries, opening that airway, using the jaw thrust maneuver, seeing if we can maintain that airway for them until EMS gets on scene. So that's really important in adults. In kids, how does this change? Anybody want to venture a guess? So Jessica says more injuries. Perfect. Oh, pull the, yes, we're going to pull that pelvic binder out of your purse that you definitely carry around with you. Lots of head injuries. Heads are bigger proportionally. Absolutely yes to all of those things. So their height and their body mass. So kids are smaller. So where the car initially strikes them is going to be different. So you're actually going to see, whereas in the adult population, you'd see maybe proportionately more tib-fib fractures. In kids, you see it's striking higher up on the legs. You're going to see more femur fractures on kids. And because they're smaller, they're going to be thrown farther. And you see here they suffer the subsequent head injuries. So let me switch my slides here. There it is. Okay, so pedestrian collisions remain the second leading cause of unintentional injury-related death in children, with 64% of them being male. So we see it higher in male children. So in adults, as we saw our previous slide, our most common injury patterns are lower musculoskeletal injuries followed by head trauma, but in peds, this is flipped. And while all auto versus peds accidents have a higher priority due to the nature of the mechanism of injuries, kids auto versus peds take a especially high priority. So make sure, remember when you're doing that initial on-scene assessment and you're making sure EMS gets called, making sure the scene is safe, make sure that you also notify them that this is a peds auto versus pedestrian, and to get that pediatric team and take them to primaries, get that all squared away. Any questions about how injury patterns differ in children versus differing in adults? It's pretty straightforward just due to the size and physiology of kids. Let's talk about elderly then. Is elderly going to be different? Is this going to does your injury risk increase with age? If we have an elderly, yeah, it's pretty simple. I'm sure most of you guys have guessed. Yes, it is. It increases your risk of exacerbation of injury. The severity of the injury and the mortality increase significantly with people who are over the age of 64. So our cervical spine injuries especially increase with age. So a study found that our CSIs, or our cervical spine injuries, were more likely to occur in the elderly, with an incidence as high as 4.4% in patients over the age of 65. So our physiological changes occur with age, like our bones become more brittle, skin and connective tissue loses their elasticity, the patient has a higher chance of being on medication that exacerbate the trauma. The most obvious of these is your blood thinners. So elderly is just being that much more aware of the increased risk of head bleed and the comorbidities and medications they can be on. So this is motor vehicle crashes is the second leading cause of injury and trauma patients over 75 years of age. I was going to say probably because of their driving skills, but we don't have to get into that. Any questions about elderly considerations? What are we gonna prioritize? Let me ask you guys this. What are we gonna prioritize? So let's say that we have an auto versus pedestrian. What are we gonna prioritize with this patient? Oh, yes, I'm almost finished too, but anybody who needs to jump off. Okay, I'm gonna minimize those. Okay, perfect. I'll just finish up. So we're gonna prioritize, obviously, when we have elderly patients, we're gonna wanna make sure that we, prioritizing head bleeds, reversing, like making sure that EMS gives that report so they can anticipate getting those things ready for oncoming receiving facilities. I'll just get through the rest of this so you guys can get off. Okay, so management and workup. So report from EMS is going to be very important, so you can anticipate the sort of treatments that you need. Also, this is for EMS too, is the post-crash emergency implications of the collision begins in the pre-hospital phase. And what's important is the geographic distance of the collision from a designated trauma center, meaning that EMS, if this happens way out, like let's say it happens out by the airport and they have to transfer from the airport, then this patient's chances of good outcomes are going to decrease. So taking them to the nearest facility is important, but not only that, taking them to the nearest appropriate facility. So those more likely to live in a rural setting and suffer severe injuries are more likely to succumb from them before arriving to a hospital. Pretty common sense, obviously. If you don't get to treatment quick, then you don't do very well. So EMS, making sure that they get timely arrival, a good report, and then timely arrival to a trauma center is crucial. Let me talk a little bit. I'm pulling up injury rates, which aren't as important. So let's talk about trauma team activation. In South Jordan, we are not a trauma receiving facility, which is unfortunate because that means that all of our traumas are going to be dropped off in our front door. We're not going to have EMS give us a report. They're just going to walk in, which means that we're going to transport them to you guys after we stabilize them. But doing that trauma team activation is important for the main, making sure that you guys get the adequate blood products, imaging. What do you guys do if initially, as soon as you get a patient in for a trauma 1 or a trauma 2 or anything, anytime you get an auto versus pedestrian, what are you guys going to want to do initially? Who do I have? Brighton, I know I have you up there. Vitals, cut and clothing, IV access, and then what first? I mean, like while you guys are doing this, you guys are like literally as soon as they get on that bed, what are you gonna want to do? And it's usually going to be the resident. So while you guys are working on that, what's the resident doing? They are assessing the pupils, but what imaging do they want to get right away? Bedside.
Chocolate. A fast exam.
They want to do a fast exam. They want to look for that abdominal bleeding. They want to see, because remember that the abdominal bleeding, while it's farther down on the injury list, is still totally possible, especially with our peds, which you guys are hopefully not going to get. But yeah, you're going to want to get that fast exam. You're going to want to get that ultrasound machine ready to go. Imaging considerations, we have a bunch of different tools we're not going to get too much into because we're out of time, but you've got your nexus criteria, you've got your PCARN criteria to decide whether or not you're going to image a smaller child. But you have other imaging criteria at your disposal. Canadian head CT, Canadian C-spine criteria to see whether or not you're going to do imaging. But that's all stuff you're going to do in the department. Does anybody have any questions? We're out of time. Does anybody have any questions about initial on-scene assessment, what to expect when you get an auto versus pedestrian, or any other questions relating to that? Nope, thank you. Okay. I guess we can skip the Good Samaritan laws, but just so you guys know, we aren't an obligated treatment state. There are 3 states where if you don't actually respond to the accident, you can be held medically liable and legally liable. We are not one of those states. So as long as you are acting with the patient's best interest, and this is very important, within your scope of practice, then you're covered by Good Samaritan laws. There you go. What are those 3 states? Wisconsin, Vermont, and one other one that I can't remember. So no tricks with a hollow pen. Well, I mean, am I
do that in movies, right?
Yeah, they only do that in movies. It only works in movies.
Yeah.
Okay. Good. Then if there are no questions, pass it back to you, Jamie.
Yes, thank you so much, Megan and Kristen.